Auzubillahi Bismillahir-Rahmanir-Rahim. Dear viewers, dear students, and dear Narians or One Health providers, today we will discuss about the occurrence of Oropouche fever in various countries of the world. I am your host, Professor Dr. Mazhar Ayaz, from Rajasthan University of Veterinary Animal Sciences, Bahawalpur, on the channel of Veterinary Problems and Solution channel. As I discussed, the Pan American Health Organization (PAHO) recently posted an epidemiological alert about the rise of Oropouche fever in various parts of the Americas region, and it has been recorded that more than 3,000 patients from Oropouche fever has been reported, and that show the similar sign to the dengue, and the symptoms are like fever, headache, musculoskeletal pain, chills, nausea, and some patients have experienced about the aseptic meningitis. As the fever is due to the virus that is from the Orthobunia virus, and that is a RNA virus, and the name of this Oropouche is from a river, Oropouche River, and Trinidad and Tobago. So the incubation period is mostly 4 to 8 days after the bite of a midges or culicoides, and the name of culicoides is Culex is the name of the Culex parensis, and so the disease is called the culicoid fever also. As it has been also recorded that the culicoides species remain involved, or the biting midges play a big threat role in the spread of biological vector diseases that are of medical and veterinary importance. Almost 50 arboviruses has been isolated from the species of culicoides, and more than 1,000 species has been recorded. In addition, only few culicoides they have the significant deleterious impact on the human existence, as they can suck the blood and transmit the various protozoal, parasitic, and the viral diseases in the human beings as well as in the animals. So they not only impact on the tourism, forestry, and agriculture industries, but also on the human health and One Health problems. The major economic impact of the culicoides is their ability to transmit blue tongue disease, episodic hemorrhagic disease virus, and African horse sickness virus. And now it has been reported that Oropouche fever, that is very less known in the veterinary and medical field, has been reported. So the biting midges have recently been identified as vector of Orthobunia virus and Schmallenberg virus also. So the pathogen transmitted to the humans culicoides include a wide range of filarial nematodes transmitted between humans like Mentionella ozardi, Mentionella persistens, and Mentionella streptocera. So it is noteworthy that biological transmission of culicoides species have the ability to transmit Oropouche fever also, that is the etiological agent of the febrile illness and about the human beings, and also include the symptoms that has been discussed earlier. So the first it has been recorded in 1955, and the countries like Brazil, Bolivia, Colombia, Peru and Cuba are under attack. These small flies that are about 2.5 millimeters long. In this way, there can be also some stiff joints, vomiting, chills, and sensitivity to light during or after the travel. These orthobunia viruses, as they belong to Peribuniaviridae family, they show symptoms like dengue, and they can be transmitted through these flies also. If a person is infected by after the biting of the midges, so most of the people they can get recovery quickly, but up to 70% experience a mild recurrence of the symptoms within 2 to 3 weeks. And there, as I told, there can be the chills, fatigue, nausea, vomiting, dizziness, joint pain, headache, muscle pain, and sudden onset of the high fever. Some rare symptoms can be the nose bleeding or epistaxis, bleeding of the gums, light sensitive to the light, spontaneous bleeding, pinpoint bleeding under the skin, that is called petechiae, and skin rashes that mostly on the trunk and arms. The central nervous systems like issues like meningitis or encephalitis that can has also been observed. For the diagnosis, RT-PCR can be of the great help, and regarding the treatment, there is no specific treatment for Oropouche fever, and only managing symptoms can be managed, and the preventions are using the clothes that have full sleeves, and also protecting nets and or medicated nets. They are also of great importance. So these midges, they can transmit like culicoides parensis, and sometimes the culex quincke fasciatus, that is mosquitoes, they can also help as a vector for the transmission of this virus. So the Oropouche or orthobunia virus, they are neglected and the less reported and less known disease of the animals, of the human beings. Mostly that has been reported in human beings, but some of the reports, a reservoir has been observed in some rodents and some animals that are present in the jungle of these countries, as has been reported. And one of the causes is that the unplanned dwelling of the human beings in their houses, and with the reduction of the forest area or encroachment of the human beings into the forest. So this can be the an alarming situation also in other countries of the world, as like it has been observed in the corona. So these infections can spread to the other countries as well. So the precaution measures must be taken at the airports, or some of the points of exit from the countries, or a strict history of the patients can be taken, or they can be traced back, that has traveled from these Pacific American countries to the other parts of the world, including the temperate countries where the temperature is quite high. So it is the time to get alert. This is time to get alert and be cautious, because more than 3,000 patients has been recorded worldwide, especially in the Argentina, and where the thick population of the countries of the countryside, they are getting disease. And this time the world must be, WHO must be get sensitized to control timely such measures. This is all about the Oropouche fever that has been recorded recently, and its reports are coming in the news media. So the information like this can be obtained from this channel, Veterinary Problems and Solution channels, and I would recommend to share, like and subscribe for the more latest information. Thank you.